I'd like to start as well by congratulating the Honourable Member for Gloucester, not just for securing this debate, but for his committed campaigning on this issue. The Honourable Member for Pontypridd says that she was sick of young women being told to take precautions. I'm sick of that too. But do you know what I'm even more sick of, Ms McVeigh? I am sick of the seemingly endless number of ways in which some men think up to intimidate and to hurt women. I have seen so much of it in the last 3 years as an MP, and I am sick of it. And we need to be equally creative when it comes to stopping them, and indeed all spiking offenders, because as colleagues have said, although it is mostly women, it is not all women. Now, sadly, it didn't surprise me to see my constituency near the top of the list when it came to support for the petitions related to this debate, because Nottingham saw a spate of spiking in the autumn of 2021, and last year had one of the highest number of reported incidents of needle spiking. The better the data we have, the better our response will be. So I'm pleased the government asked the National Police Chiefs Council to establish a reporting mechanism so that all police forces can centrally report any incidents of spiking. This will help us gain a better understanding of both the scale and the nature of the problem. I also know the government has worked with clubs and bars and with universities to raise awareness and to help prevent spiking. Nottingham Trent University, for example, has funded intervention training for staff in city centre venues, and many universities have increased bag searches at events and provide drinks protectors and kits to test for spiking. Rushcliffe has also benefited from the Safe Streets funding, with nearly £250,000 providing West Bridgeford and Trent Bridge with new safer street wardens in the evenings and more CCTV. And I'm also a strong supporter of the Enough campaign, which highlights the different forms of violence against women and girls, including spiking, and the simple acts that anyone can take to challenge perpetrators of abuse. Because at the end of the day, only a society can change a culture. I do, though, take on board the comments from the chair of the Home Affairs Select Committee, and I hope that the Home Office will be reviewing the campaign when it comes to spiking. I'm also pleased the government has reclassified the date rape drug, GHB, so that offenders face up to 5 years in prison. On the issue of a specific offence on spiking, I know there are already a range of offences that could, in certain circumstances, cover spiking. But what we really need to understand from government, and from the report which I think is being published at the end of April, is how effective efforts to prosecute incidences of spiking are under these existing laws. We also need to know what the average sentence for spiking offences prosecuted under these laws has been, not just the maximum penalties for these offences, which is what the government is currently publishing in response to parliamentary questions, because that's the only way in which we can gauge whether the existing penalties are likely to provide sufficient punishment for spiking offenders. Because I think we need to send a very clear message from this House. Spiking is a vicious attack. And if you are going to attack people in this way, whether your weapon is a pill slipped into someone's drink or a needle jabbed into their arm, you should expect a custodial sentence. Yeah.